All right, Doctor, thank you for sharing all your tips with us. And I'm pretty much sure that users enjoyed it and it will make their work more precise and simpler after watching this webinar. And for more information, in the new update, fantastic preparation review feature has been added. So please update it and try them out. Right, next, let's move on to the Q&A session. So let me read the question number 1. Sometimes the occlusal contact points of the crown are too high. It happens randomly. Can I get some advice to solve this?
Okay, so if you scan a crown and you get a crown back and the occlusal contacts are too high, meaning that the crown is high, there's one of two reasons. Either when your lab designed it or milled it or produced it, it was too high, or when you scanned it, the bite registration is inaccurate. It's only one of those two reasons. So I do a lot of same-day dentistry, so I do the design and milling in-house. And I know sometimes you're in a rush and you design the crown and sometimes it's a little too high. So it can happen on the design side. You can't control the design side, I assume, because you're sending to a lab. So what I would suggest you do from your side is make sure your bite registration is accurate, and you need to check that. And commonly what can happen is if the bite registration isn't accurate and you're getting this overlap, the lab may manually adjust this. And then this is where you can get some occlusal issues with your restorations. One way to figure out, if you ever get an open contact or a high occlusion or something like that with your crowns, one way to figure out if it's your scan or the lab is to ask the lab to print you models from the scans they designed on. So if they print you models and the crown fits perfectly on the models, then you can't blame the lab. It is your scan, because your scan didn't match what was in the patient's mouth. If you place the models and you place this restoration and everything looks perfect, you know, again, your scan is the issue. If on the model the crown doesn't fit properly, either open contact or it's high on the models, then you know maybe it was a design or milling fault. So that's how I would check. And definitely any occlusal issues, you need to check the bite registration.
All right, next question. How many units of the bridge you're working on?
I'm not sure I quite understand that, but if you mean how many units have I scanned, I've scanned everything from like a 4 unit. I mean, that's probably the maximum I would do for a bridge anyway, because anything more than that, I'm usually thinking implants or something else. But yeah, look, I'm not quite sure what the question exactly is asking for, but I will say this: scanners confidently can scan anything. Okay, the only thing that you need to think carefully about is full arch implants, and this is where scan gauges come in and photogrammetry. But for dentate scans, if you have teeth and gums, confidently I've scanned pretty much anything and had great results.
I see. And question number 3, it is too difficult to scan soft tissue between implants. When I'm scanning the emergence profile, it just literally stops, like lose focus and can't stop anymore. Just like the image this user sent, and any tips?
Yeah, so this user sent this image about how hard it is to scan the implants, and this is basically the first step of implant scanning. Before you place the scan bodies, you have to take off the healing caps and then scan the emergence. Now, I see a lot of issues with this scan, and I think this is why the user is having some difficulties. So I see a lot of artifacts here, and a lot of basically what looks like the cheek or maybe some gloves, but this is all causing the scanner to have issues, frankly, because the more artifacts you have here, the harder it's going to be to continue the scan. You also have some of the artifacts here. I'm not sure if this is the floor of the mouth or the tongue, but to answer the user, I've used Medit and basically every scanner to scan multiple implants, to scan implant bridges, and I can guarantee you, if you just control the soft tissue very well, and get it immobilized so it's not constantly moving, place your scanner in the right area, start the scan, and move in a very smooth, consistent motion across this area, you will not have an issue. If you are having an issue, I need to check your software, because there's some things like sometimes your associates play with the scanner and you don't have the right scan depth setting, or you don't have the right AI setting. I see maybe this is a screenshot and the user looks like they may be in the right AI setting. But these are all factors I would check. In terms of scanning the area in between in this part, I've never had an issue, frankly, of scanning this area between two implants. If you're finding while you're scanning it's deleting areas automatically, I would basically turn off the AI and be a little bit more aggressive with that. But as long as you keep the scanner at a certain vertical height over this area, and that's consistent, you're not moving up and down a lot, you shouldn't have an issue scanning this.
All right. So doctor, just quick question. So actually there is a scan filtering option to literally filter the unnecessary soft tissue at the bottom of the scan software. And the default option is the second one. So do you switch it for, depending on the cases?
I personally, I control most of the soft tissue clinically. So I don't like to play around with the software too much. I like to have one setting that I like and I just use it, and I don't spend time every case changing the software. Be aware, guys, that this software is there to help you. If you find it's beneficial for you, and in some difficult cases it can be, then this is the button that Sue was mentioning. It's a little cut off, but down here, and I mentioned it previously in the webinar, this is where you can control the AI. And so I just keep it at 2 for the vast majority of indications.
All right, thank you for answering. Right, go to the next question. Does the laptop have to be plugged into a power adapter while doing scanning, even if it's at 100% battery?
This is a great question. And the short answer is yes. I actually had this, I ran a hands-on course with Medit scanners a year or two ago, and I had one attendee come and tell me the scanner is so laggy, there's so many issues. And when I showed her, when she showed me how she was scanning, it wasn't plugged into the wall socket. Why this is an issue, even if your battery is 100%, is that most laptops, if they're not plugged into power, they're not using 100% of their GPU, the graphics card. So basically, if you're not plugged into the power socket, you're not using the full performance of your laptop, which will be a big problem for these softwares, which are not super high demanding, but they do require power. So always have your laptop plugged in. The only exception to this is, from my understanding, Mac, which seems to just, it seems to have a lot of advantages over Windows, but that's a different story.
Right. They use this kind of different like processor.
Exactly.
Right, go to the next question. I just found some little scratches on the edge of the tip mirror. Does that affect the scanning speed or accuracy?
Depends how severe the scratches are and how many there are. A lot of the time, minor scratches on the scan mirror. I mean, the easiest way to tell this is that when you're taking a scan, you usually can see that scan window of what the scanner is seeing, and then you have your digital impression. So if you're looking through the scan window and there's a big gash or a big scratch, then this is going to be an area where the data can't be captured. So yeah, it can slow you down, it can cause issues. But if it's minor scratches and it's not actually being seen by the sensor, then you can continue to use the scanner tip. It really just depends on the severity of the scratches. When in doubt, I would suggest replace them. But yeah, I mean, scratches can range from surface to big gashes in the mirror.
All right. And the last question, how do you scan metal, such as highly polished custom abutment? It is challenging for me, and there is a metal scan function, but I don't think it really helps me.
I mean, this is a great question. And again, I personally scan metals just by putting the scanner on the metal and basically scanning it from as many different angles as I can, because it's all about getting that light to reflect away and not into the sensor fully. So that's how I do it. I very seldom need to do anything else. if you haven't had much success with the metal scanning mode, the only other recommendation I can suggest is use some adjunct to your scanning. So a lot of these metal scan bodies, I believe you said, or scan posts, a lot of them these days can be sandblasted lightly, and this can help tremendously with scanning metals. The other thing you can do is just use some scan spray, or even something like occlude, which is the green spray for dentures, anything like that that's not going to create a very thick film, because you don't want to disrupt the geometry of the scan body or scan post, but you just want something that's going to go on the metal and prevent so much reflection. Once again, I never use these things. I find just by scanning alone, making sure all the lights are, your overhead light is not shining on the metal. That's also a key part. And make sure your loop lights are turned off, because any lights on that metal can make it harder to scan. But just try tackle it from different angles all around that metal, and I find that works. And if that doesn't work for you, use a scan spray.
All right, thank you for answering all those questions. That's all. All right, so let's wrap things up here. You'll be able to watch this webinar after we've completed on our Medit online training platform or YouTube Academy, Medit Academy. And I would appreciate your feedback. And if you have any questions or any feedback, please contact meditedu@medit.com, meditedu@medit.com. And thanks for being here, Dr. Ahmad.
Thanks so much for having me. It's a real honor again to be invited to this webinar series. I do enjoy it. I like teaching about what I love, which is digital dentistry. And thanks to all of you for watching and listening. And I hope you got something out of it. Just leave your comments or reach out to the Medit team if you have any questions, and I'll be happy to help. But thanks a lot, guys. Take care.
Take care. Bye.
See you later.